Dr. Indar, the Caribbean Integrated Food Safety Program, you work in 26 countries in the region, and surveillance, outbreak control, food regulatory support is all carried out in a collaborative manner. So can you tell us a little bit more about how do you share the work amongst experts in the region? Who does what? Do you bring them together for all activities?
Good afternoon, and thank you for allowing us to be here. So just to give a little bit of background, CAFA is an integrated regional public health agency, and we serve 24 countries. And the nature of the work requires that form of regional cooperation and harmonization. And the work that we do that to involve regional cooperation and harmonization is really through first our regional mandate. So we have an intergovernmental agreement with governments that really mandates us to provide and technical cooperation and to promote health for the region. So it means that whatever we are doing, we are operating in a regional manner. And then through our collective action, we would then move ahead in terms of regional guidelines, capacity building, training, and so on. Our integrated foodborne program actually started a while ago in 2004. And that started CAFA, before CAFA became the Caribbean Public Health Agency. We were a PAHO WHO agency. So we started an integrated program in 2004. And to create that integration, when we started, and this was done, in fact, in very close collaboration with PAHO, so that we started to have that integration from the beginning. We invited at the beginning all the major players at a country level involved in foodborne disease. So the environmental health specialists, the epidemiologists, the laboratorians, the policy persons, and so on. So we invited these multi-sectoral persons. And then we invited the different agencies. So one of our speakers were talking about that there are many different agencies doing some of the same things. So we invited, FAO, AICA, FDA, and so on, CDC, and so on, different regional and international agencies that was doing foodborne disease surveillance work. And we came up with plans of action that really talked about what did you need for integrated foodborne disease surveillance, what were the gaps, and how we can best approach this towards improving the capacity for surveillance response in the Caribbean, and how we can do it in a collective manner. So that was one of the first things we did, and we then followed up, even when CAREC was dissolved and CAFA came into being, we then followed up. How did we follow up? Our work was built on specific activities. So, and again, these are aligned with the WHO foodborne disease surveillance goals, building capacity in surveillance and response. This is regional capacity, building regional research. So, for instance, we conducted a regional burden of illness studies that provided, this was done in 11 countries, and it provided the evidence we needed for foodborne disease surveillance, for food safety. It told us, what were the different problems, and so on. We also did regional capacity building, but the capacity building and training was done with accountability. So when we trained the countries, we didn't just train one person, we trained the different sectors and the different laboratories, and they were to go back home and implement. And to follow up with that, we would then have quarterly meetings, which we still do. PAHO and CAFA would have quarterly meetings with foodborne disease teams. So the country feels accountable. We provide that regional technical guidance together with funding, which they couldn't do as being small countries. So this has been really the way we have worked within the Caribbean, and the success has been, I would say it varies because our Caribbean countries vary. Obviously, we have small countries of 60,000 people, and then we have our biggest was now Haiti, but previous to that was Jamaica, about 2.2 million. And the countries vary not only in size, but culture, in capacity, infrastructure, human resource, limited infrastructure, and finances. So we have to, that's the context we operate under. And our biggest success has been involving in having that regional cooperation and having that integration where we follow up to get things done.
So I think it's fair to say that as a region, the Caribbean has done quite a lot in regional cooperation. Are there challenges that remain? Are there things that you say, oh, if we could just get these little parts farther?
Oh, well, what a question. There are a lot of challenges. And I think the challenges come from the fact that we are small and diverse populations of different capacities and different cultures. And different infrastructure. So some countries can, be able to do proper laboratory analyses of identifying a foodborne disease bug and tracing back. There are some countries cannot even test for a salmonella or a shigella. So that's what we are dealing with. However, because we are such close borders, if there is an illness, let's say in Barbados, you're almost sure it's going to go and travel to another country because of this rapid inter-island travel. So we have to then to ensure that while country X may not have the capacity, that then there are proper procedures where we can make sure testing is done and so on. So the challenges are that diversity, the varying levels of development. One of our challenge too is the prioritization of foodborne disease and food safety. So don't quote me, but many ministers don't, or the high-level officials don't see food safety as a priority unless there's an illness, unless there's an outbreak. And this is when the phone call comes and, oh, can you come and can you change this now? And they expect us to, magically make the problem disappear. So that has been a big challenge. And that is, coupled with that, is the fact that there's limited resources. So every country, unlike some of the bigger countries where you have funding for different areas, food safety is part of communicable disease. It's the same person that is doing everything, but it's the same small pot of funds for everything else. So it means the sexy disease like HIV and other things, and now Zika and so on, get more money, and food safety is lower. So because of that, we would have had to create regional food safety policies that we are hoping that gets going so that it can be funded. Another big challenge we have in the Caribbean, though, is communication and coordination and turf issues. So we find for food safety, it's not just the epidemiologist and the laboratorian. You have to work with your environmental health persons. You have to work with your veterinarians. You have to work with your policymakers and your legislations and so on persons. But it's funny, they're all sometimes in the same building and they just don't talk to each other and they don't share information with each other. So one of the things we started to do very early is to bring them to speak to each other. And we had comments like the veterinarian or the national veterinarian would say, I never met him, and we work in the same building. So communication and that turf between the different sectors, between lab, between agriculture and health, as well as between the clinical and the food lab, not sharing information. So those were some of that, lack of integration, lack of communication, and of course the ones I just said, the lack of human resources and so on.
Thank you, Lisa. We'll switch to Dr. Barbosa.